We have bioethicist Dr. Sarah Rosenthal from the University of Kentucky, as well as Dr. Richard Paulson, director of the fertility program at the University of Southern California. Joanne Colleen is here as well, spokesperson for Nadya Suleman. Guys, I said I think that the system may have failed her here. And I have to say, I've been in practice before, back in the day when I had a real job. I was in practice for years, and a lot of times I was asked to evaluate patients for elective procedures, whether it was plastic surgery or whatever it might be. And I just got to tell you, this stinks to high heaven to me. An unemployed mother with 6 kids coming in and implanting 6 embryos, and it's the same doc, at least the same clinic, that has done this before. Does this not fall below the standard of care?
Well, Dr. Phil, I think that it's important to point out that this entire clinical management of this patient has been done backwards from my perspective. First of all, regardless of what the guidelines say regarding how many embryos you can actually implant, there needs to be a conversation with the patient ahead of time surrounding selective reduction. So for example, the patient requested that 6 embryos be implanted at once. The physician has a very clear ethical duty to discuss with the patient, all right, we'll put in 6, but if this results in too many babies developing, are you willing to undergo selective reduction? Okay. The patient says no. It's clear that that should guide the clinical management and guide how many embryos get implanted. So I would question that at the outset. Why did that not occur?
Well, Dr. Paulson?
Well, we don't know whether that occurred or not, right? So I think it's important to point out that we don't actually know until the medical record has been examined exactly what transpired and how this came out. But if we believe what we have heard so far, that in fact, after 6 children, she came in and had 6 embryos implanted, then yes, that would of course fall outside of the guidelines and below the standard.
Is that what happened? Did she go in and is that what she says? That she has reported she had 6 embryos implanted, right?
That's correct.
With the doctor that did the other kids, so the doctor knows that the mother is unemployed, doesn't have her own home, has 6 kids because they're in the waiting room.
It doesn't sound good. I agree with you. But, you know, I've seen enough situations where things look one way, and then once you start picking at it and the story comes out, there's some extenuating circumstances. So I keep holding out hope that there are going to be extenuating circumstances.
Give me an example of what could be something to mitigate the ridiculousness of how this appears.
Well, I must admit I can't think of anything, but that doesn't mean that it's not going to come out. It could happen.
It could happen.